Hello everyone, this is Marika and I welcome you all to this new session of nursing management. In our previous sessions, we have discussed various interesting topics such as what is hospital, what are the different objectives, what is the scope of the hospital. We also discussed about the classification of hospital, the organization and functioning of the hospital, and ward management and factors influencing ward management. In this session today, we are going to discuss another interesting topic, which is emergency and casualty services. So when we discuss the organization and functioning of the hospital, we already have seen that an emergency is one of the most important department within the hospital. In this session today, we are going to see in detail what is an emergency department and what are the various services that are provided in emergency department. Emergency and casualty department, whether it is in a private hospital or in a public hospital, it provides care to the medical, surgical, orthopedic and all different types of emergencies that may arise in human populations. Any emergency department or a casualty department provides care to all different types of emergencies. It may be a medical emergency or a surgical emergency or any other kind of emergencies. An emergency department provides care or provides the emergency care to the patient who comes to the hospital on their own, who are brought in by their relatives, who are brought into the hospital by the police, who are also brought to the hospital as a result of road traffic accidents, or people who are brought into the hospital due to any kind of other emergency conditions such as poisoning, fall, etc. Now, from the term itself, when we say emergency, it is understood that prompt and effective care must be provided to the patient who comes to the emergency department, because many a times the patient may come into the emergency department with a life-threatening condition. The care that is provided to the patient must be prompt, it must be fast. Delay in initiating the care may also lead to the death of the patient. Therefore, in emergency department, the people working in the emergency department must be very alert, must be very aware about the disease conditions and what can be done in order to solve those problems in case of emergencies. Let us see what kind of patients with what problems may come to the hospital in the emergency department. We have already seen in the introduction there can be medical problem, there can be surgical problem, there can be orthopedic, or there can be any other form of emergencies for which the patient comes to the emergency department. Let us see what kind of patients are seen in emergency departments. The very first type of case that can be seen in the emergency department is injuries. So the patient may come to the hospital in the emergency department because of any kind of injuries. It can be road traffic accidents, it can be suicidal injuries, or it can be homicidal injuries. The next type of patient in emergency department can be the patient suffering from burns. So burns is also an emergency. So patient with burns might also reach out to the emergency department in the hospital. The third type of case that can be seen in emergency is poisoning. The fourth reason why patient can be seen in the emergency department can be a sudden onset of an illness, or it can also be because of the increased intensity of the existing illness. These are the few reasons why people come to emergency department. They may come because of injuries, they may come because of burns, they may come because of the sudden onset of the illness, or maybe because the existing illness increases in its intensity, and they may also come because of poisoning, falls, etc. Moving on, let us see what is the function of the emergency care or casualty. The very first function is to receive the patient who comes for an emergency treatment. When a patient walks to the emergency department, it is the responsibility of the team working within the emergency to receive the patient. Once the patient is received, it is also the function of all the team members within the emergency department to decide the appropriate management according to the case of the patient. We've already seen that the patient comes to the hospital with various problems. There can be various different reasons for the patient to come to the emergency department. Here, the team should attend the patient and also must decide the appropriate response or the appropriate management according to the condition of the patient. Now, this may include various things such as emergency resuscitation of the patient, providing first aid for the patient, emergency investigation for the patient, hospitalization for the patient, as well as referral of the patient. So these are the first few things that is included in the proper management of the patient after receiving the patient within the ward. Another important function of emergency department is also to observe the patient and to understand whether the patient actually requires to be admitted in the hospital or the patient can be referred to the outpatient department. So here the team members within the emergency department must be very quick in analyzing the problem of the patient to also decide the appropriate management of the patient, whether the patient is to be resuscitated, whether the first aid is to be provided, if the patient is to be admitted, whether the patient is to be referred to another specialty, or whether the patient can be kept under observation and the patient can be told to take the treatment in the outpatient department. Another most important function of the emergency care team is to provide reassurance or a short counseling session for the family members. So we have already discussed in the introduction that people come to emergency with a life-threatening condition. Sometimes there is a chance that people may be in life-threatening condition. Therefore, reassurance and short counseling must be provided. The second major function of the medical emergency care team is to carry out the medico-legal formalities. So as a team in the emergency unit team must also look after the fulfillment of the medico-legal formalities. The third function of the emergency care team is to maintain an up-to-date report or list of the critically ill patient in the emergency. Now, emergency is not like any other ward where a patient has a long stay within the emergency department. Once the patient is treated in the emergency, the patient is shifted to the department where the patient can be treated according to the illness. The patient may be shifted to ICU or may be shifted to a medical or a surgical ward depending on the patient's case. In the emergency department, an up-to-date list of all the critically ill patient must be maintained for the purpose of few things, which includes issuing a visiting pass to the relative. In the emergency department, all the family members cannot be allowed. Visitors are restricted in this department. Therefore, in order to issue one visiting pass for the relative, the emergency department must always update the list of critically ill patient present within the emergency department. Another reason why the critically ill patients list must be updated with the medical care team is to decide whether they can take the transfer of the patients from another hospital or not. So in an emergency department, there are already many patients who are being treated. When we have a list of all the patients who are critically ill, requires emergency treatment and are within the emergency department, it becomes easier for the team members to decide whether to accept or reject the transfer of the patient in the emergency department coming from the other hospitals. Not just the patients coming from other hospital, it will also assist them in intra-hospital transfer. Another important function of the emergency care team is to have the list of the doctors working within the emergency. So there are different doctors who will be working in the emergency, but there should be a list of the available doctors, and if in case those doctors who are assigned the responsibility of emergency department, if they are not available, the replacement for those doctors also must be listed out. And finally, the last function of the emergency care department is to be prepared for mass casualties in times of disaster. We are already aware that in times of disaster, there can be mass casualties. Disaster causes various casualties. There can be many number of people who come to the emergency, and many number of people may require the help in the emergency department. Therefore, the emergency care team must always be ready for the mass casualty in times of disaster. I hope you have understood the function of emergency care. Moving on, let us see the site area and designing of the emergency. You all must have noticed that the emergency department in most of the hospitals is located at the ground floor. So emergency department are supposed to be located in the ground floor and preferably right inside the main gate of the hospital. The lights, the board of the emergency department must be well lighted and it must illuminate in the dark in order to make sure that it is visible for the patient while they come to the hospital, even for the first time. The emergency department is supposed to be located in the ground floor with a proper board, and the board should also illuminate at night in order to ensure its visibility. The second thing in the designing of emergency is that it is always preferable that outside the emergency or nearby the emergency, the department where more number of people visit or more crowd can be seen is avoided. For example, an outpatient department or a reception area is usually not made nearby the emergency because a lot of people may come to the reception, a lot of people may come to the outpatient department. Therefore, all of these areas are kept away from the emergency or casualty. So let us see the important areas other than the casualty that helps in smooth functioning of casualty. Casualty or emergency is one department, but for the emergency department to function effectively, there are other departments that are necessary. Let us see what are those. The very first one is the reception or the inquiry. A reception or the inquiry counter, as we have discussed before, is a place which receives the people, which receives the patient and directs the patient according to their condition. Therefore, emergency department needs the reception department wherein people can come, inquire, ask about the emergency department, and they can be directed towards the emergency department. Another important department or another important area that is required for the smooth functioning of the emergency department is the waiting area for the relatives. So here in emergency, as we have seen, the patient may come with many number of relatives. Therefore, it is always preferable to have a waiting area right outside the emergency department for the relatives and the family members. The third thing that is required for the smooth functioning of emergency is space for keeping the trolleys and stretchers. In emergency department, the patient may not be able to walk in on his own and come for the treatment. Therefore, wheelchairs, the stretchers and the trolleys are required to bring in the patient and take back the patient from the emergency department. We need a proper space for arranging the wheelchairs, the trolleys as well as the stretchers, so that it can be used whenever required. Along with the space for the trolleys or the wheelchair, there should be space for people such as the ambulance driver or the trolley or the stretcher boy. So in order to use the stretcher or the trolley, even though it is located right outside the emergency department, people are required, manpower is required. While it is planned, must also have space for people such as ambulance driver or a trolley boy to rest outside the emergency department. It should also have a space for the security staff. In the emergency department, we are already aware that there will always be a security present. Therefore, the space that is required for the security also must be planned while designing the emergency. Moving on, let us discuss about the facilities to be available in the emergency department. As the patient enters inside the emergency department, the patient is kept under examination or observation. In the examination area, the patient is to be attended immediately. We know that in emergency situation, prompt actions are required from the emergency care team. So as the patient enters inside the emergency area, proper actions, prompt actions must be taken, and therefore there are certain things or certain facilities that are required in the emergency area to make sure that the emergency department functions smoothly. The first facility in the emergency department is an emergency examination room. So in an emergency as well, an examination room must be set up with 2 or 3 tables inside the examination room to examine the patient whenever required. In the examination room, as I told, there will be 2 or 3 tables inside one examination room, but they will be separated by the use of curtains to maintain the privacy of the patient. The tables in the examination room must be as such that the procedures such as emergency first aid or cardiopulmonary resuscitation must be possible to carry out on those tables. The second facility that is required in the emergency is a treatment room. In a treatment room, minor procedures such as catheterization, giving injections, suturing of the small wounds, bandaging, or dressing of the small wounds are carried out. The third facility that is required is an observation area. So an observation area, as we are aware, must be an area where the patients are kept under observation to understand if the patient requires further hospital admission or the patient can be treated in the outpatient department. Different kinds of patient can be kept in the observation area, such as patient waiting to be evaluated by a particular specialty, patients who are waiting for any kind of medical or surgical procedure, patients who have waiting to be shifted to the appropriate wards or appropriate center, patient requiring indoor admission who are brought in critical conditions. Now, after initial treatment and after the stabilization of the patient, such kind of patients can be shifted to the ward. But for a certain period of time, the patient is kept under observation in the observation area. And finally, the patients who are likely to become fit after the immediate attention by the medical professionals can also be kept in the observation room. For example, patient with epilepsy or dehydration. Once the cure is provided to the patient after a period of time, the patient is likely to be fine to go to their respective houses. So such kind of patients are also kept in an observation area for a certain period of time, and then after the stabilization of the patient are sent home back. The fourth facility required in the emergency for the smooth functioning of emergency is the storage facility. So obviously a storage area is required in order to store the linens that can be used in the emergency, the drugs, the equipments, the articles that can be used or that may be required in an emergency. Another important space that is required in the emergency department is the space for keeping the swelled linens. So whatever linens are used in the emergency, there should also be a storage area where the used or dirty linens can be stored. Electrical connections, medical gas connections, and vacuum connection are also to be present in the emergency department, and every emergency department must have a generator in order to produce the electricity. And finally, we have other supportive services, which includes a clinical laboratory for carrying out certain emergency investigations. The second one is radiology, mainly X-ray, ultrasonography, and CT scan. The third department that is required nearby the emergency department for the smooth functioning of the emergency department is the blood bank. Along with blood bank, operation theatre are also required in order to carry out emergency operations or surgical procedures on the patient. These are other facilities that are required for the emergency department to function smoothly. That is it for today's session. In this session today, we have discussed about emergency and casualty services, wherein we've seen what kind of services are provided in emergency and casualty, and we've also discussed about the other facilities that are required for the emergency department to function effectively. We also discussed about the functions of emergency department. I hope you've understood today's topic. So to conclude, today we have discussed a very interesting and a very short topic, which is emergency and casualty services, in which we discussed about what is an emergency department, what kind of patients can be seen in the emergency department, what is the function of the emergency care team, and finally we also discussed about the other facilities that helps the emergency department to function smoothly. I hope the class was helpful, and I'll see you all in the next session. Thank you and have a great day ahead.